Hello and welcome, dear students, and today I bring to you a very important concept, that is antepartum hemorrhage. Now, when I talk about bleeding in pregnancy, I talk about two different phases of pregnancy. One is the early pregnancy, the early phase, and the next is the late phase, that is mostly the second and the third trimester. Now, basically the cutoff is 20 weeks and so. So anything that happens before 20 weeks is considered as an abortion, all right? And now you have so many different multiple terminologies which has been introduced for abortion. We do not use blighted ovum, missed abortion. Now in fact we use an embryonic pregnancy, embryonic demise, so on and so forth. So these things have changed. Plus they have very categoric definitions. When exactly will you label it as embryonic demise, when will you call it an embryonic pregnancy, and you will counsel the patient for or break the news to the couple about their abortion. That's a separate topic. I'll be covering that too very soon under this case discussion. But today's topic is antepartum hemorrhage, where we're going to focus on the late pregnancy bleeding. And basically it's going to include conditions like placenta previa and abruptio. That's the mostly asked question in your exams. Now the viva can hover around vasa previa and rupture uterus, but basically as far as case discussion is concerned, that's a choice that you might not get. So today's case discussion is about placenta previa and abruptio. So we're going to be done soon. So my case is my patient X, wife of Y, aged 32 years, resident of so-and-so place, is G4T2L1A1 with LMP so-and-so, making her ADD so-and-so, and gestational age 27 plus 3 weeks, is an unbooked case who came to emergency department with complaint of bleeding PV since 2 hours. Her fetal movements are perceived fine. History of presenting illness. My patient was apparently alright since today morning when she started having bleeding PV since the 2 hours back. This bleeding is fresh bleed, soaked one pad since. It was heavy to start with but decreased on its own after half an hour. In this entire period, she soaked one pad only. This bleed is not associated with any pain abdomen or leaking PV. There is no history of any trauma or any injury. Patient does not give any history of piles or any local lesion from which has been bleeding before. Patient gives history of being informed by her local gynecologist that her query placenta in her own language is situated low and that she should abstain from sexual intercourse or lifting heavy loads or any jerky movements. She also had such episode 1 month back, which was managed conservatively.